We can support education of clinicians and their administrators and the behavioral health clinicians, either through webinars, through our website, or we can come directly to a location and provide a day-long seminar that will cover all the essentials of this technique and enable people to feel confident in bringing these into their medical offices on a daily basis. Health insurers would benefit enormously from this. I like to tell people that the correct diagnosis, no matter what it is going to be much better, much more cost-effective than no diagnosis at all. What typically happens with these patients is that they get one diagnostic test after another. They sometimes get invasive treatments up to and including surgery. The cascade of events that happen to these patients when they are fruitlessly looking for an organ disease or a structural abnormality to explain their symptoms ends up with enormous cost. One of my patients came to me after 55 years of abdominal pains. I saw him back in the days of paper medical records. Volume 3 of his chart was 8 centimeters thick. He had been through, one test after another, all kinds of diagnostic trials. The amount of money that had been wasted that was represented just by that one volume of his chart was huge. And yet, within a month of appropriately diagnosing his stress issues and treating them, his symptoms went away. So just making the correct diagnosis, applying the correct treatment, and your outcomes are vastly better. So its cost is improved, the patient outcome in terms of their health is improved, and the physician satisfaction, just removing the frustration that typically surrounds these patients and replacing it with the satisfaction that you've made a difference in their lives is incomparable. The benefits of a psychophysiologic approach to patients who don't have a structural abnormality or an organ disease are enormous, because what has been the norm up to this point is that the patients are just simply a source of frustration. The physicians throw up their hands, they don't know what to do. The patients demand answers. The typical assumption is that there must be an organ disease or a structural abnormality that's been missed, and that can lead to a fruitless search in the form of diagnostic tests, looking for, under every rock to try to find something that's been missed. Diagnostic procedures, therapeutic procedures, invasive therapeutic procedures, and the cost of these adds up, and of course the risk to the patient, the inconvenience, the discomfort, the time off of work, the disability, all of those lead to cost, not necessarily to the health insurer, but certainly to society, to the patient, to their family. It's endless. And imagine the contrast between that and making the correct diagnosis, uncovering the issues that are responsible for the symptoms, addressing those issues, and not infrequently you see substantial improvement and better outcomes in just a matter of weeks with many of these patients. Now, it's true that some of them are going to need psychotherapy, which isn't free, and some of them may need psychotherapy for months or even a few years. But those patients, the most severe small fraction of the spectrum would also be the ones that would cost the medical system the most money. So making the correct diagnosis and applying treatment based on that diagnosis is always going to be superior, not only for the patient, but for the healthcare system as a whole. The PPDA offers particular benefits in the high utilizing population. Now, clearly, some of those high utilizers are going to be people with primarily medical conditions, severe diabetes, severe mental illness, severe heart and lung disease, cancer, and so forth. But if you go through the high utilizing population in your group, you're going to find a significant fraction of them that don't have any of those problems, that just appear to have a myriad of physical symptoms that are just coming back and coming back and coming back to their clinics, that may be admitted to the hospital for diagnostic tests that are not uncovering any issues. One of my patients was 51 days in the hospital in a 9-month period of time with not a single positive diagnostic test. That population, we can uncover the psychosocial issues that are responsible for their symptoms, get those specifically addressed, and the patients are going to improve, and their cost utilization is going to drop substantially. And that is a group that we can offer tremendous benefits to by training frontline staff in the questions to ask and what to do with the answers. Dr. Cindy Stone reached out to me probably 3 years ago now and asked me to be involved with supporting her work in educating frontline family doctors in using mind-body assessment and treatment for their patients that came into the clinic for any of a range of complaints. And with my support, she put together a wonderful, relatively limited, just 6-hour program to teach her family doctors how to do this. And the doctors didn't get any administrative time for this. They did this on their own time because they could see the value of it. And there were initial concerns, could they do this? They were going to have to clearly diagnose and treat these patients themselves because the numbers that they were going to encounter were going to be too much for Dr. Stone, who's their behavioral health director, to manage by herself. So they were going to have to not only take on the diagnostic part, but a significant fraction of the treatment part. But they embraced this because they could see it was going to be a vast improvement on the frustration and the lack of anything productive that was typically the case for this patient population. And it's worked out brilliantly here in a very representative, perfectly normal primary care practice, and it absolutely can be generalized to any primary care environment and even many specialty environments. Anywhere that you have some behavioral health support, this can be done with a transformation to the patient outcomes, the physician job satisfaction, and the costs. So you're going to get benefits in all 3 areas from a relatively small investment in training.